On a much larger scale, the Republican Party's refusal to allow President-elect Joe Biden to begin his transition is hurting America's ability to respond to the pandemic, and it is making things worse for longer. Someone who knows firsthand about the damage done by this delay, Dr. Atul Gawande, a professor at the Harvard Chan School of Public Health, a surgeon at Brigham and Women's Hospital in Boston, now a member of the Biden-Harris Transition COVID-19 Advisory Board. Dr. Gawande, how do you see what the incoming administration, which folks like yourself had to do, what they have to do in the next 65 days to get ready to take the baton, even if it's not passed on January 20th, to fight the virus?
I mean, here's the situation. We got some tremendous good news this week with Pfizer results on a vaccine that shows us that there is light at the end of the tunnel. And so now that gives us a target. We have to get the country through that tunnel with all the people we can alive and as many jobs as we can saved. That we now have a target. So, you know, the good news is that, and for a scientist and doctor like me, it is an enormous relief to see that both Vice President-elect Harris and President-elect Biden have said this is their top priority coming in on day one. And so what I see is they're moving.
All right, so we got to get through the tunnel. Obviously, there's no formal power that the president-elect and the vice president-elect have. We're all running out of words to describe how bad it is. This is the worst thing we've ever seen in terms of the outbreak. Today, 151,000 cases. We have 67,000 people that are currently hospitalized, shattering the old record of 100. That thing, when you look at that red line there, it's almost vertical case growth. And when you look at hospitalization, it's getting close to vertical in hospitalizations. And I think if you look at the positivity rates in a lot of these states, it's pretty clear that the cases are actually lagging what's really happening. Can we ride this? Like, it seems the plan is to ride this out. And I guess the question is, let's say we do nothing. How bad does it get?
It's math. And the math is simple and it's alarming, right? We have a doubling rate of about 4 weeks on hospitalizations and deaths. That 67,000 you described in a month will be double. And moreover, the deaths will go from 1,000 to 2,000 deaths a day. And it's not just about the lives and the harm involved. It's also about the jobs that go along with that. There's data out of Michigan today from their hospitals showing that when they followed up 60 days after people got out of the hospital, survivors who had a job before, 40% of them had lost their job. Half of them because the job was no longer there for them, and half of them because they simply couldn't go back to work. It's damage to our health and its long-term health, and it's also the economic damage that's going on.
So there's a few things that seem to me important. One is lame duck Congress passing some kind of rescue package that would allow local policymakers to make public health informed decisions rather than threading these needles that they all are now. And we're watching them torturously not want to kill off the surviving restaurants and the surviving bars, the surviving gyms, all that stuff. So they're making these half measures. So that's one thing. I guess the second thing is, what else? I mean, it doesn't seem like there's any appetite for lockdowns. The messaging, I guess, matters. Like, if all of MAGA world just went around telling everyone to take certain precautions, like, could that help?
No. The mix here is we've known it, and it's straightforward. It's masks, and we have to start requiring that the businesses enforce masks, that we all come together. You can't just mandate your way into getting everybody to wear masks, but we got to get it over 90%. If we do, we turn this around. Second is testing.
Let me stop you there.
Much more widespread testing.
I want to stop you there. You think if we could hit, because I'm trying to pull myself away from despair. You think that if we could get mask compliance up to 90%, we could actually break the back of this current curve?
Absolutely. It is very clear. And we have parts of the country where we're up above 95%, and we have large parts of the country where we're nowhere near there. And, the critical elements are, it's not just outdoors in public, it's also indoors in public. And it has to be combined with, it's going to be so hard over the holidays when everybody just wants to come together and eat, which means taking off the mask. But, those occasions, the small gatherings, going to restaurants and bars, are the biggest spreaders. And then, add in weddings and other events like that. Those are, that's where testing comes in. Hey, if you are going to come together, get tested. Testing is much more accessible now.
Yeah.
And we can, if we get tested, we have a better chance of protecting one another. You have to also follow through that if you test positive, you isolate.
Well, yeah, for the love of God, yes.
You don't. Well, but I can tell you, I just got off the phone with a state where the infectious disease doctor told me that they're seeing 30% up who are not adhering to isolation after testing positive. So we all got to come. This is the thing. We can get through this tunnel, but we've got to have leadership that pulls us together to say we're in this fight together.
Yeah.
And come across all of our lines to make that possible. It simply doesn't happen if you don't do that.